Hi everyone, happy Monday! Today I am joined live by Dr. Q of the account Pelvic Floor Galore, and we will be discussing all things pelvic health and very specifically the rectal dilators and wands. And he's going to be popping in here shortly and tell us about his practice and all of the things that he treats. He provides amazing services in this world. So if you have questions for him, don't hesitate to pipe up and ask them in the chat. And he will be joining us any minute now. And then if you have any additional questions on treatment protocols, how to use rectal dilators, wands, vaginal weights, anything, don't hesitate to drop them here. Also, if you have to pop off before we are done, this will be saved and we will store it on our page. While we're waiting for him to come in, does anyone have any questions for me on this lovely Monday morning? There he is. Hello, Dr. Q. Hi, Dr. Q.
Hi, Dr.
How
Amanda.
are you?
Doing well, thank you. How's your day going?
It's good. I think we're both on Pacific Standard, so we're both just getting things going, right?
Yes. My morning just started.
Very, very good. Well, thank you so much for joining us. Do you want to start by telling us about your pelvic health practice and tell us who you treat, what you love to treat?
Absolutely. Yeah. So I founded Willpower Wellness and Physical Therapy. I'm a pelvic floor physical therapist, and I mainly I treat a lot of men, a lot of folks in the queer community. Of course, I treat everybody, but I specialize in sexual health, so sexual dysfunctions emanating from pelvic floor dysfunctions.
There's a huge need and it's growing because people are realizing they don't have to live with the issues that they're facing. They don't have to just put up with it. It can get better and they can have the life that they want.
Absolutely, and it's so great to empower people, especially because there's so much stigma and misinformation around this area that people can really get treatment for this. And, this is a quality of life improvement that more folks are paying attention to. So that's what I'm excited to see this kind of grow as well.
Absolutely. So, what kind of diagnoses are you commonly seeing in your wellness practice and clinical practice, which of course are intertwined?
Yeah, of course. So I definitely do see a lot of men who are post-prostatectomy who are experiencing urinary incontinence, but I also really treat urinary frequency often too. Um, for younger males, a lot of pelvic pain symptoms, um, even other sexual dysfunctions, including erectile dysfunctions, ejaculatory dysfunctions. Um, so I would say that makes up a huge bulk of it, as well as anal dyspareunia, so painful receptive anal intercourse. Um, so yeah, I treat everything related to the bowel, bladder, sexual functions. But those are the main ones.
Absolutely. And which Intimate Rose products do you find yourself commonly utilizing as part of your comprehensive plan of care?
Absolutely. So I often recommend the rectal dilator set, um, which, yep, I love those. I love that they're graded and they're tapered and they are shaped for that cavity so that they kind of stay in place better. Um, it's a little more comfortable for folks to leave in, and that just makes it easier to recommend and prescribe a routine for patients to start using them at home. And so, love the rectal dilator. I think it's very unique, and the patients love it. So, Yeah, I
Oh,
used
that
that.
made my day.
Yeah, I was so excited when you released those actually. What kind of um, spurred the decision to expand to that?
Definitely patient demand.
Mhm.
We had the vaginal dilators, which, starting with the smallest and progressively getting bigger. Previously, that was what was available. And so people were using them rectally for outlet dysfunction, training the anus for receptive intercourse, like you said, and then those who have had cancer treatments that are having issues with anal stenosis. And it was working for the most part. The biggest feature that's important on any device for any sort of rectal training, of course, is the stop at the end
Mhm.
of the product. So it was working, it was getting the job done, but definitely in talking with my fellow clinicians and patients and hearing what the need was, we heard a big need to have something progressive that started very small and very gentle. So for those that have had like anal cancer and radiation treatment, starting very small, or those who are pediatric, who may have inflammatory bowel disease such as ulcerative
Mhm.
colitis or Crohn's and are needing to retrain for bowel movements. Starting very, very small was really important, giving a lot of flexibility to respect that natural curvature of the rectum initially was really important. So we started with the two smallest, and then definitely heard the need for that taper, as you just said. So a really gentle, I call it an on-ramp, like to a
Mhm.
freeway. So an
Yeah.
on-ramp to build up to the diameter needed for the actual dilation component, and then also being able to slip down and give it a break and take a break, and then it can be used then conversely to help with outlet dysfunction of drop relax for expulsion training as well. So we wanted to fit a lot of different features into one product, and so that that's how that came to be.
Oh, I love hearing about how, the process goes. And um, as you mentioned, the design is like perfect for the area. The patients really enjoy it. It makes it a more comfortable process. Um, and it makes it unique. So a lot of patients like that because they can't get that anywhere else, really. Yeah.
I love that. That's the goal. And then just working to make them really comfortable, because that can be, it's a highly innervated area. It can be
Mhm.
very, very sensitive. So using a really unique finish to make it softer, and then of course bright and cheerful, because why
Yeah,
not?
the colors make people's day too. And yes, definitely with patients with pain, they're very, hesitant to get started sometimes with dilator training. So the fact that they start at a very thin circumference and are all tapered, allow patients to more comfortably and on their own, um, just listening to their body, seeing how it feels to slowly and gently stretch the tissues in that region. And yes, especially with stenosis, um, it can be very uncomfortable, but with the dilator set, it makes it more of a cakewalk.
It's just uh, it's tiny little steps every day, that low load, long duration hold of stretching the tissue, but also being just respectful of your body and giving it a break when it needs it.
Yeah, that's so important. And, you want to get that compliance. So the easier you make it for them, the more that likely they'll stick to that plan and succeed.
Absolutely. You are so right. And then I think you had mentioned too the vaginal dilators. You tend to work
Yes.
with these a fair bit.
Yes, so those are really important, and yes, you can use them rectally, as people have been doing before, but um, yeah, especially you can have stenosis in the vaginal canal or front hole region, um, a lot of overactivity in that region, which can lead to pain. Patients who have difficulty inserting tampons, um, dysper regular dyspareunia of the vaginal region. It's helpful uh, for anyone seeking front hole assistance.
Do you tend to have like a couple of exercises that you like to prescribe along with dilator training that couples together in your plan of care? Like I know as providers, like we all have kind of like our treatment paradigm and we've got a couple of things that we like to implement. So do you have like some favorites?
Yeah, I my favorite go-to if the patient has that range is, the happy baby type of pose where you're kind of hugging your legs and that kind of brings a passive stretch to the pelvic floor structures, widening the hip bones, paired with some good 360 breathing, um, just to promote that lengthening of the pelvic floor muscles, the down training. Um, and, if they have, I'll recommend the dilator handle extension as well if it's difficult to hold that position. Yep, exactly. Especially with people with, shoulder range of motion impairments or limitations, or maybe just older folk in general who have more arthritic joints, that definitely helps. So if they can hold that happy baby position with a dilator in place, cued with the breathing, can really be an effective way to make the muscles relax for you and have the dilator do its work.
Absolutely. Those are some of my favorites too. And then how about the wand? Do you find yourself working with the
Oh,
wand?
yes, definitely. And I love that there's so many different types of wand modalities. So, of course, and they all come in amazing colors. So, yeah, the regular wand you can use any trigger points that, I've identified with the patients. I'll tell them here, insert the wand in this position, then this specific position and angle, and try to, hold and, press onto that region for a little while and try to get a good release of those muscles. Um, but the vibrating wand I use the most.
Mm,
And that vibratory input to the muscles, which you can place externally or internally, can help promote relaxation of the tissues there. Um, so, for people who are a little hesitant about going internally, you can absolutely use it around the perineum, around the sacrum, again, to get some relaxation to facilitate that down training, lengthening of the muscles. Um, and then you can venture into internal work, which the vibration also will help. And what I like about the vibrating wand is, if you are noticing a lot of stiffness, it, vibrates, so it can kind of wiggle in or out more easily. You just leave it there. So it kind of just does the work for you in a sense. Um, so I think that's really versatile. Um, and as well as the um, the heating function
yeah.
within the other wand. Yep, yep. So that can help bring some circulation to the region and again facilitate relaxation. So I love that there's all these options for folks.
Absolutely. And people can just choose, people tend to know themselves. Like, if I'm in pain, do I want to grab an ice pack? Do I want to grab a hot pack? Do I want a massage? Do I like that vibrating chair at the mall? Does that feel good? The people tend to know their sensory systems pretty well. Sometimes they like the guidance from a provider as to which do you think is the best for me. I think that universally, the vibrating wands have been the biggest crowd pleaser because of all the reasons that you stated. It is really relaxing. It does a lot of the work for you. It does introduce blood flow. Patients can self-select the frequency. There's 10 frequencies, so some of them are very soft and soothing, and some of them are a little bit more oomph to them, and some
Mm-hmm.
people like and need that. Especially if it is a male post-prostatectomy and they are reaching really from the back end of the pelvic floor to the front to reach around some of the scar tissue from where the instrumentation was. Turning it up a little bit can be really helpful to reach some of those distal spots.
Absolutely, yeah. The vibrating wand is so versatile, and there are two ends as well to it. Um, exactly. So, um, and the whole unit can vibrate and provide the same sense of applying the vibratory input, but um, they're both pretty thin, so anyone can get started with that. Um, and even for entrance dyspareunia, so painful intercourse near the entrance of the vaginal area, that tapered area can really help. Yep, help with that entry pain. Again, promote relaxation. Oftentimes, I'll recommend using that one prior to having intercourse to, reduce the tension in that region and decrease the likelihood of experiencing pain.
Like a warm up.
Yeah, like a warm up stretch.
Yeah. For the big game. And then how about vaginal weights?
Yes, vaginal weights are amazing. I love recommending them to patients, especially those who are like eager and they're like, oh, how else can I, shake up my strengthening games? And so, like, I'll definitely recommend that for patients to try putting in the weights, um, seeing how, hold them for starting 15, 30 minutes, whatever they can tolerate. I love that it gives patients who are struggling with um, the ability to sense performing a pelvic floor contraction well, because this provides a little bit of stretch and a little bit of weight for the muscles to be able to sense, and you kind of just grab it onto them with your muscles. So in terms of a motor learning standpoint, the vaginal weights are amazing for patients who are struggling to connect with their pelvic floor. And so, yeah, patients who really want to connect to the pelvic floor or shake up how they're strengthening and using the pelvic floor, especially for endurance. As we know, endurance muscle fibers in the pelvic floor are more dominant. About 70% of our fibers down there are endurance muscles. So if I can have them using the weights regularly, I know they'll be um, getting in those exercises and being compliant with the endurance training. So that's where I really love using them.
It's perfect. You're absolutely right. 70% endurance. And additionally, that brain pelvic floor awareness can be really tough for patients. We cue them in clinic and we've got a tactile cue, we've got visual cues, and they do pretty well. And then they go home and some of those cues aren't available to them and they suddenly don't know if they're doing it right. So the vaginal weight is going to tell them right away because if they bear down, it's going to come out.
Right. They'll feel something slipping. And so that, yeah, exactly like you said, that little tactile cue internally, that weight, the pressure, the stretch, um, it really lets them get in tune with their muscles.
Absolutely. How about contraindications? Do you find that there's certain patient populations that you would go exercise or manual only, or how's that look for you in your practice?
Yeah, so typically for me, since I see a lot of male patients, I am very mindful of their history if they have, fissures or hemorrhoids, which can arise from overactivity of the pelvic floor muscles. So we just want to make sure they're in the clear, not having any active episodes or recent bleeding within, 2 weeks or so, depending on the severity. Um, but we really do need to get that balance because we want to get in the right time and start slowly to kind of undo. A lot of these are long-term habits that folks have developed, and we need to start really slow with the dilators when they are healed, and just really monitor. Are you having intense pain? Are you noticing spotting? When you're wiping, like a little bit of blood, a lot of blood. And so that's where, communication is important and making sure we are stretching the tissues adequately, but also within their tolerance.
One of the cues that I like to give is, the pain scale, which I know people struggle with a lot, but if 0 is nothing and 10 is worst pain imaginable, when you're using any tool, but especially like vaginal or rectal dilators, we don't want you to be beyond that 2 to 4 out of 10 buffer window, because your body, it's not about shoving it in. It's not about no pain, no gain. And your body is going to try to protect you. So if you're overstimulating or pushing into a pain zone, the muscles are going to guard, and it's going to cyclically reciprocate into the pattern that we're trying to break. So we want the dilators to be a pleasant experience, in that it might be uncomfortable because we are changing the tissue and we are asking it to elongate and do things that are new to it, which feels different, but we don't want it to be in the actual pain zone.
Absolutely. Great point you bring up. For folks who think they need to push through the pain and like work through that, no, not the case with this. You do have to listen to your body, and for some folks, you do have to tell them, you know, take it a step back. Your body is trying to tell you something, and the central nervous system is heavily wired and connected to your pelvic floor. If you're fearful, painful, those muscles will contract and work against you, which will cause even more pain. So, the most important thing is to focus on relaxing the muscles the best you can and working within a tolerable pain range, which won't spike or get that protective response.
It's a helpful tool, not a not a no pain no gain, which is where
Yes,
our type of therapy is so different from other types of rehabilitation. People are familiar with an ACL tear, or they had a shoulder injury, and in those kinds of physical therapy, the physical therapists and the patient sometimes have to push through some pain barriers to get that range of motion back post-operatively. And this pelvic health is not that. It is in fact the opposite. We are looking to provide the tissue with a break, perhaps for the first time in a long time if it's a chronic pain patient.
absolutely. Yeah. So it's a lot of retraining. A lot of patients don't have any connection or knowledge of their pelvic floor. So to kind of start introducing the idea of this and how to retrain some of these habits that are developed at the pelvic floor, like holding tension due to stress. Not a lot of people think about that. They think about their jaw or their shoulders being hiked, but the pelvic floor is another huge component, and patients are so grateful once you bring them into that world of pelvic floor health. And yeah, it's so empowering. And with these tools, it just makes it all easier.
I'm so glad to hear that.
Yeah.
For these, you see so many men, and there's all these different diagnoses that can bring up all these different like feelings, and weaving pelvic health therapy into a busy schedule is often really hard. For like a chronic pelvic pain patient that's male, that maybe has like a seated job where they're getting a lot of compression on their pelvic floor, and they are maybe not getting a lot of good circulation and movement, and maybe the job is stressful. What are some cues that you give them, or how do you work with them to weave in your plan of care, whether it's the stretches that you've given them or tool therapy? How do you kind of break that down for them?
Yeah. Yeah. So with folks who are sitting a lot for their job, the first thing I want them to try to do is get up when you can. So you're not sitting all day. Try to take a break every hour, just to stand a little bit, to get some circulation into that region and reduce pressure over time in the perineal area. There are some cushions that can be helpful as well to provide relief of the area, but the more we can get them standing, the better. Um, but while they're sitting, they can also focus on their pelvic floor. So I have people do self check-ins throughout the day. Uh, Try to feel your pelvic floor. Are you holding a lot of tension? Take a deep breath in. See if you can relax that tension. Then you'll know, oh, I was contracting or holding myself too tightly at rest when I shouldn't be. So being mindful during a seated position and trying to take breaks where you can are crucial, I think, for everyone. You know, you don't have to wait until you have pain, but yeah, those are some easy things you can do, incorporating your habits, um, if you are sitting a lot during the day.
I found with all patients that the moment that they first recognize their tension, so if they're living with chronic pain and they've been living guarded and restricted in the pelvic floor, has been living in this kind of elevated state, and we're doing our therapy, it happens at different stages in rehabilitation. Sometimes it's after the first visit when they've gotten that sense of where their pelvic floor is, and sometimes it's months down the road. But the first time they come back in and they're like, I felt it. A nasty email came in and I felt myself guard up and tension up, and I was able to drop it. I think is one of perhaps like the coolest parts of rehabilitation, because it's such a powerful tool of them being able to sense and recognize it, and then feeling the power of what happens when they volitionally drop and let go.
Yeah, that's a major turning point for patients because it's so important and so difficult though for patients to get in tune with relaxing the muscles and what that feels like. Yeah, so it's easy to tell people to relax, but to actually do it, especially in your pelvic floor that you can't really see, it's internal. So once they develop that connection, yeah, it's so much better for them. They'll notice, they'll catch themselves in a guarded position. And so being able to relax from that position is crucial.
Absolutely. What else? What else do you want people to know about your practice and about pelvic health?
Yeah, so I do a hybrid model. I am based in Los Angeles, but I do see patients via telehealth as well,
Fantastic.
for pelvic health, pelvic coaching, all of those. Um, and I just wish to decrease the stigma for all people seeking pelvic health services, especially for sexual dysfunctions. Um, More so with men, because men's health is behind in pelvic health, at least, so just being able to spread greater awareness for men's health, being able to provide um, resources for queer communities who are seeking help, because again, there's so much misinformation. People don't know the pelvic floor exists. People don't know you can get treated. You don't have to rush into medications or surgery. But with pelvic floor therapy and some supplements of tools, modalities, um, it's also possible. We've seen it time and time again.
Yes, you will not be the first to present us with something. We have seen all the
True. Yeah. People are so shy and they're like, oh, am I telling you too much? And I'm like, no, this is perfect, and you are not the only one. So um, this is all very treatable. And sometimes they just need to hear that and they're like, oh, thank goodness.
I think what you just said is it's the most powerful gift that we can give them, is that you're not alone, and this happens and it is fixable.
Yes.
And you do such a lovely job of it. And June is Pride Awareness Month, but it's not just about June, it's all the time.
Right.
And men's pelvic health has come a long ways. I think, thinking about specifically physical therapy, and now occupational therapy and physical therapy are working together. Our academy has been around for 43 years now,
Hmm.
doing what was then termed women's health and
Right.
now pelvic health. But a lot of providers have been doing this for 20 some odd years, but we're just now getting better at
Mm.
promoting and educating the public that we are here and we are available and we are a safe place to come, and then also building our skills up to those issues that are very
Mhm.
specific to men's pelvic health, not just post prostatectomy, but all of the other different myriad of things and the psychosocial emotional component that goes with it to create that safe space. So what I've observed, I've been doing this 15 years now, is that within the last 5 years, people like yourself and others are just doing such a phenomenal job of really shedding that light on men's health. And I'm so thankful.
Oh, yeah, definitely. Thank you for that. As you said, things are emerging. Um, Men's health is becoming more of a topic of discussion, there are a lot of societal barriers for men seeking pelvic health. but the best we can do to spread awareness, to normalize seeking care for men's health, and just reassuring people that this happens, this is not just a women's, you know, region, or everyone has a pelvic floor. And so being able to just normalize this is what I want to see in the future. Um, and again, it's more than just Men's Health Month or Pride Month. It's every day people are facing these issues. So to be able to bring awareness to those points on a regular basis is important to me.
Absolutely. Where can people find you in your clinical practice?
Yeah, so I'm located in Pico and Beverly in Los Angeles, and I also have a satellite clinic in Tarzana, and of course telehealth. You can um, find me at willpower.me, my website, or pelvic floor galore on Instagram. I love puns, so.
I love it so much. As soon as I saw your email come through about the willpower, I just loved it so much. That's great. And so those links are all in your bio here
Yep,
on Instagram.
they're all on my profile. Yep.
Perfect. So people can find amazing care there. Is there anything else that you would like people to know before we close out?
No, I'm just grateful for the opportunity, and so happy that your products are available for folks. And they're life changing. So keep doing that good work.
Thank you so much, Dr. Q, and same to you. Thank you so much for all the awareness that you bring and the great education, and for bringing your just special self to helping people find their place. So if you are located in Southern California, do not hesitate to reach out. And then telehealth available. There's so much good that can be done via telehealth, and especially if you don't have access to Southern California. The wellness can be international, national, or is it just to California for your license?
Right now, I'm focusing on
Sure.
California, looking to expand in the future.
Plenty of people in California.
There are a lot of people here, yeah.
Wonderful. Well, thank you so much for your time. Thank you for coming on and sharing your insights. And I'll look forward to talking to you again soon.
Absolutely. Thank you, Dr. Amanda. Have a good day, everyone.
Have a good rest of your day.